Acepental. Detailed information on pain relief and anti-inflammatory medication. Acepental is a nonsteroidal anti-inflammatory drug NSAID used to relieve pain and inflammation in conditions such as chronic osteoarthritis, rheumatoid arthritis, and ankylosing spondylitis. Pharmacokinetics. Absorption. Acepental is rapidly absorbed after oral administration, but its oral bioavailability is only about 50 due to strong binding to plasma proteins and first-pass metabolism in the liver. Distribution. The drug is widely distributed throughout the body, especially in musculoskeletal tissues. Pharmacokinetics. Metabolism. Acepental is metabolized in the liver. Excretion. Acepental is primarily excreted in the urine. Indications. Acepental is indicated for the relief of pain and inflammation in chronic osteoarthritis, rheumatoid arthritis, ankylosing spondylitis. Contraindications. Acepental is contraindicated in patients with active peptic ulcer disease or a history of suspected peptic ulcer or gastrointestinal bleeding due to its gastrointestinal side effects. Acepental can worsen ulcerative conditions or cause gastrointestinal bleeding. Contraindications. Moderate to severe renal impairment. Acepental is excreted by the kidneys, so in patients with renal insufficiency, its use can lead to drug accumulation in the body, causing renal toxicity. Contraindications. Relative contraindication in patients with severe hepatic impairment. Acepental is metabolized in the liver, so in patients with liver insufficiency, its use can lead to drug accumulation in the body, causing liver toxicity. Close monitoring of patients is necessary during treatment with Acepental. Contraindications. Pregnancy. Acepental should only be prescribed to pregnant women in cases of absolute necessity and should be used at the lowest effective dose. Patients with a history of hypersensitivity to aspirin or other NSAIDs. Acepental may cross-react with aspirin and other NSAIDs. Precautions. Closely monitor for adverse effects of Acepental, especially gastrointestinal side effects such as abdominal pain, nausea, vomiting, diarrhea, constipation, and gastrointestinal bleeding. Use Acepental at the lowest effective dose and for the shortest possible duration. Precautions. Do not use Acepental in children under 18 years of age. Drug interactions. Acepental may interact with several other medications, including anticoagulants. Acepental may increase the risk of bleeding. Diuretics. Acepental may reduce the effectiveness of diuretics. Antihypertensive drugs. Acepental may reduce the effectiveness of antihypertensive drugs. Drug interactions. Antibiotics. Acepental may reduce the effectiveness of some antibiotics. Adverse effects. Acepental can cause various adverse effects, including gastrointestinal disorders, abdominal pain, nausea, vomiting, diarrhea, constipation, gastrointestinal bleeding. Hepatic disorders, hepatitis, liver failure. Renal disorders, renal insufficiency. Allergic reactions, rash, itching, edema, dyspnea. Note: this is only basic information about Acepental. For more detailed information about the drug, please consult a doctor or pharmacist. Do not self-medicate with Acepental without a doctor's prescription. Always read the instructions carefully before taking any medication. Additional information: Acepental is a prescription drug. Acepental is available in the form of tablets, capsules, and oral solution. Acepental is manufactured by various pharmaceutical companies. Additional information: this additional information provides a more comprehensive overview of Acepental. Always remember that medication use should be under the guidance of a doctor to ensure safety and effectiveness for your health.